Raise the thigh. If you don't want to do that, if the table is not low enough, you can also like hold it down so that they can do it. But in the picture, as per the picture, they are keeping their knee on top of their thigh, and then so that they can use both of their hands to do the distraction and compression. Chavo, can you come a little bit this way? So let's first do with distraction. So with distraction, you just have to distract the knee first and then do medial and lateral rotation of the knee. If there is a pain, that means they have ligament sprain. Versus once you are doing a compression, and doing a medial and lateral rotation. If they find pain there, that is meniscus. Okay, so that's it for uplift, compression and distraction. Positive is pain and pain during compression or distraction, and that depends on what is injured. And in case of McMurray's test, the patient goes supine and then you keep their knee in flexion. So we can actually do this in different degree of flexion. So I will just start with almost 90 degree of flexion, and the examiner medially rotates the tibia and extends the knee. So you medially rotate the tibia. When you are medially rotating the tibia, there is more pressure going. Lateral meniscus. So you are actually medially rotating the tibia and extending it. Which test? So when you are actually indicates the loose fragment of lateral meniscus. To test the medial meniscus, examiner laterally rotates the tibia. When you laterally rotate the tibia, it's actually testing the medial meniscus, and when you are medially rotating the tibia, it's actually testing the lateral meniscus. So medially rotating the tibia and extending, which is testing the lateral meniscus, and when you are laterally rotating the tibia and extending it, it is testing the medial meniscus. You can also repeat it in different degree of flexion to see where the tear is. Okay, so that is McMurray's test. Different portions of the meniscus are tested by varying the amount of flexion in the knee. So you can actually vary the flexion to test different parts of the meniscus. Any questions? Okay.
Actually, it is lateral.
Positive is a snap or click with pain. Snap or click with pain.
You are doing both lateral and medial, depending on which meniscus you are testing.
For medial, you do
Lateral rotation. Yeah.
For the last special test, do we need to do distraction first and then do compression, or do we do whatever others?
According to slides, you do distraction first and then compression.
Is there any reason that we want to do distraction first, or
I don't think so. It's just that they want to check the ligaments first before the meniscus, I guess. But I don't really see any specific reason why you have to do distraction first.